I am Dr. Carey. I am a pediatrician in Ventura, California, and we are talking baby care. Today I would like to introduce Brittany. Brittany is the mother of Simon, who has had less than a comfortable experience with food allergy and intolerance. Welcome. Thanks. So you have your baby, and your baby was a little more fussy than typical. Why don't you tell me about that?
Well, the first, 4 months were just miserable. I think he just screamed excessively, and I didn't know if it was the difference between something really wrong or, you know, he was my second, so knowing if that's just how a second baby acted. And one night he screamed so much, he was screaming from, I think, about 4 p.m. to 11, and we just didn't know what to do. I would just lay him down and kind of leave him there so I could get a break and then go back in and try to comfort him, and nothing really worked.
When he screamed for so long, was that just nighttime or was it all day and all night?
It was pretty much all day and all night,
Mm-hmm.
Lots of hours at a time.
So when one thinks of colic, we think of a baby who is a dream in the hospital, will cry an hour or two per day during the first month or two of life, and by 3 to 4 months of life they're crying 3 to 4 hours per day, and then at 4 months it all goes away. This didn't really fit that, did it?
No, I kind of looked into that, and it just it didn't quite fit the mold, but he just cried so much that I thought it must be colic or it must be something more serious.
Did your friends attribute it to colic?
Well, my 3-year-old daughter, when she was a newborn, we thought maybe she had colic, so I kind of just assumed that until it seemed like it didn't really fit exactly the same.
Before you had an indication of what was going on, what had you tried to relieve that?
Well, I would feed him, I would change him, I would rock him. My dad would come over and walk him around the block. My husband would take him and walk him, and we did everything we knew to comfort a baby, and those things just didn't work.
What was your first indication that maybe it wasn't just simply colic?
After a couple months, he had blood in his stool, and so that obviously scared me. We went right in and did a sample, and after a couple weeks, they discovered it was lactose intolerance. Or something like that. Intolerance
or allergy, or something was going on. When you talk about blood in the stool, how much was there? Was there a ton, or was there a little streak?
Just little tiny specks. They just looked like little dots of darker color than newborn stool.
Was it clear to you that it was blood at first?
Not at first, but it took a little bit. My husband and I both kind of checked it out and saved the diaper and called the doctor, and then we figured it out. And after, I think he had 2 diapers with it before we did the sample. It's really hard to know how to test a baby when this happens. Obviously, when a baby is brought to a pediatrician, because there's blood, we worry about obstruction, we worry about inflammation, we worry about other things that are going on that are very serious. But in this case, your baby's growing well, gaining weight well, has calm periods, and is crying and little specks of blood, correct? Right.
And often in my office, I'll check for blood in the stool to make sure that it is blood, which it was, and then we'll check for, I like to check for something called reducing substances, which is a test to see how well the sugars are digested in the gut, whether they're being digested or they're just passing through. And then if they're passing through, it gives me more of an idea that we might have an intolerance here or some reason. It's certainly not a specific test. There are many reasons why it can be positive, but it gives me an indication of which way to go with that. And I believe it came back positive, and we're thinking, okay, we have some type of allergy or intolerance to milk. And then the question is, what are we going to do about dairy? And that's a little complicated because you're breastfeeding, right?
Correct.
So what did we recommend for you based on your breastfeeding?
Well, I just cut out dairy, so I don't eat dairy. Cut out cheese and milk and yogurt and all that stuff. And we tried a few other things as well when I changed the diet, but it kind of came down to just the dairy. And I just cut it out. And
it wasn't an easy thing to do, was it?
No, I mean, it took a while. When I say I just cut it out, it took a couple weeks to figure out what I was allowed to eat and what I should eat, if I should cut out anything else. It was really quite overwhelming for a few weeks, and I was very hungry for a while because I just couldn't figure out what to eat.
I don't think that's an easy process to go through for a mom who's breastfeeding to try to eliminate dairy. I know that years ago I had one mom who was in our office whose child was having a similar problem, and mom was a dietitian and she went to eliminate dairy, and she even had difficulty making sure that her diet was void of all dairy and that things were right. And once you did that, how long did it take to notice a change? Was it instant? Did it take a few days?
I would say within 3 days. He was a new kid.
Really?
Yeah, he was so much happier. It took a week or two to figure out what I could and couldn't eat, but then once I kind of had a system down of meals that didn't have any dairy in them, he was so much more calm, easier to calm when he was fussy. He started sleeping more. Just, it was an instant change.
So it really shows that even when we have this problem, there's really no reason why one cannot continue breastfeeding. It just means a lot of modification and diligence upon your part, and having to do away with a few things that you'd really like to have in your world.
Yes.
Sometimes when a child is breastfed and we're trying, bottle fed, excuse me, and we're trying to figure out which way to go, we switch formulas, and I will go to something that is considered non-allergenic or hypoallergenic, because if we switch to a soy formula, there's still a chance that the baby can have the same problem. You don't really know whether you've eliminated the issue or not. But when breastfeeding and you can eliminate dairy, that's great. And it can take up to 7 days sometimes to really know what changes happen. When you felt that you made a mistake in your diet by introducing dairy, how fast did it take for your baby to react, did you feel?
Typically it would be a couple hours. I'd either see a rash or he'd be really uncomfortable, kicking his legs. You could tell that he kind of had a tummy ache.
Okay. So really, it's interesting. It happens fast once it's introduced, but then it takes 3 days to finally get the proteins out of your system, so it doesn't affect the baby, which gives you an idea of how much is stored in the body and how long it takes for items, whether it's milk or medications or whatever, to finally fully be eliminated from your milk supply. We're 6 months old now.
Yes.
And you started to introduce other foods for Simon?
Yes, he's had a little bit of rice cereal and a couple of vegetables.
And how's he doing with all of that?
Pretty well. Yeah. He still prefers breastfeeding over the food, but we're working our way up to it.
Perfect. And your intent to breastfeed is for how long?
A year, at least a year.
And then at that point, we're left with a question of what to do, because we still have this issue of how he's going to do with dairy. And by now you know that it's not really clear-cut when to reintroduce dairy, is it?
Right. I guess that's the big question now, is when should I start introducing it while still breastfeeding, and when should we give it to him when he starts to eat more solid foods?
And that number really varies from person to person and how they decide to do things. 1 year is often the mark where someone will consider trying to reintroduce something. 3 years is also cited, and anywhere in between, there's really no right or wrong. And there are many ways about doing that. One can pump the breast milk and mix a small portion, 10% of whole milk with the breast milk and introduce it that way, versus going straight to milk. One can see how we do with cheese or yogurt first. So I think that really leaves a lot of questions. Now, we've had some rashes also.
Yes.
And at what age did that start?
Oh, right away. He had kind of rashes on his neck and chest, and sometimes on his, like the backs of his arms and his back. And I can only attribute it to the food, but I never really knew what was going on.
Has it disappeared once you changed your diet?
For the most part, he still has really sensitive skin, so a rash can show up at any time, and I never really know if it's because he wore new clothes or was outside, or if I ate something. Typically I can tell if I sneak in a little bit of dairy, his rash will flare up.
So it does flare when you introduce something.
Mm-hmm.
Because it's really difficult sometimes to know where the association is. Is it really what we ate causing what we see, or is it not? And then your child has sensitive skin to
Mm-hmm.
begin with, which makes the association really difficult, which is why, although we're going about dealing with this through food challenges, saying, okay, what happens if we give a little dairy? What happens when we take it away? It's really not, at the end of the day, the definitive way of finding out what's going on.
Right.
But often, sometimes the other tests are rather expensive or rather invasive, and if this seems to work, there's really no reason why this isn't a reasonable way to go.
Mm-hmm.
Now, obviously, if we hit 1 or 2 years of age and we keep trying to reintroduce something and we keep having a problem, then it really comes down to trying to figure it out and really going after the allergy side,
Yeah.
which is fraught with complications, because you'd like to do skin testing, but doing skin testing on a little baby isn't exactly an ideal solution.
Yeah.
Blood testing can be done. It's not always the most accurate, but it can give one an indication. You had similar episodes with your little daughter in some ways that you think may have been related?
Yeah, looking back now, she's 3 now, and looking back, I think the first 6 months were kind of just as miserable, and she was my first, so I didn't know if babies just acted like that, or if it was something I was doing that was putting her in pain, or if there was something more serious going on. She spit up a lot, and she seemed to have sensitive skin too,
Mm-hmm.
so it seems kind of similar, but not exactly
quite
the same.
You certainly have the sensitive skin theme running through the family. Is
Yes.
that you or Dad who has the sensitive
That's
skin?
me.
Okay, so it's your fault for that one.
I know.
That's okay. In trying to distinguish why a baby is crying and what's going on can be really difficult. I think the big marker here was the streak of blood in the stool that said, okay,
Yes.
we definitely have some problem with the proteins here. We definitely have something going on with the gut that's leading to a problem. And fortunately, with diet modification, you were able to continue to breastfeed. You were able to continue to do what you wanted, and I think that's wonderful. And now the road is really down a ways to see how we transition, hopefully, back to whole milk and a regular diet, and with luck, not having as many skin problems.
Right.
Wonderful. Well, thank you, Brittany, for joining me in discussing your son's milk allergy / intolerance and what was going on here. I am Dr. Carey, and I thank you for watching. For more baby care education and to sign up for our free newsletter, please visit us at drcareys.com, where at Dr. Carey's, we teach baby care.
Breathe in, breathe out. Breathe in, breathe out. Okay, let me see your ears.